Well, South Africa has been criticized for its slow vaccine rollout, despite being one of the first countries in Africa to receive the COVID-19 vaccine. Now, to achieve herd immunity by the end of the year, at least 125,000 people must be vaccinated each day. There have been several hiccups along the way with both phases of the vaccination. So tonight we ask the question, why is it taking so long to roll out vaccines and what are the consequences? To help us answer that is Professor Shabir Madhi, Professor of Vaccinology at Wits University. Prof, thanks so much for your time. We appreciate it. The reason I asked to speak to you is because I saw a tweet and it worried me. You tweeted a graph about the vaccination pace across several countries, and you said that this graph says it all. To be clear, you said, and I'm going to read your tweet, it's not only about vaccine nationalism, but poor decisions that were made. There should be consequences as thousands more lives will be lost from COVID in the next 2 weeks. So take us through the graph and why you're saying that.
So there's information that's shared in the public domain with regard to the number of vaccines that have been given per 100 people of the population of any given country. And there are some countries at the moment that have administered more than 100 doses per 100 people of the population. And that's obviously because many of these vaccines require 2 doses of vaccine. South Africa is one of those countries that really lags behind globally when it comes to what percentage of the population has received even a single dose of the vaccine. Right now, that sits at less than 1%. For other countries such as Qatar, such as United Arab Emirates, such as United States, United Kingdom, Israel, those countries have now vaccinated more than 50% of their population. And even other middle-income countries such as Chile, which has got a very similar sort of economic status as South Africa, has already vaccinated a high percentage of the adult population. So we're clearly lagging behind when it comes to what percentage of the population has been vaccinated, and there's multiple reasons for that. But the major reason in my mind as to why South Africa lags behind is, unfortunately, as we know, government only really started to engage actively in bilaterals with companies around about early January of this year, after it came up against criticism from the scientific community for the lag in terms of undertaking those sort of bilaterals. And consequently, we ended up being at the back of the line when it comes to when we were able to access vaccines. So in South Africa, unlike other low-income countries that unfortunately simply don't have the financial muscle to be able to actually engage in these bilaterals and procure vaccines and are very dependent on a COVAX facility, South Africa being an upper middle income country, the expectations always was, including with a COVAX facility, that we would pretty much be paying almost market prices for these vaccines.
So that's one poor decision that many people have spoken about. But what are the others? Because I'm going to look at this holistically in terms of what government has done, because government continues to defend itself and use that excuse, I would say, that we had to wait, that the West and richer countries are hoarding the vaccines. That's what we were told. What are the other poor decisions that were made?
Yeah. So firstly, the only reason the other countries, and including some upper middle income countries such as South Africa, were able to get vaccine as early as January, February of this year, was because they had started these engagements with companies around about August of last year, even before the vaccine efficacy trials published their findings. So they were early off the mark in terms of engaging in bilaterals, which South Africa was not. Unfortunately, it appears that one of the other reasons why we ended up being where we are, because of the Ministerial Advisory Committee, and these are public statements made by the chair of the Ministerial Advisory Committee, that he felt it was more proper for South Africa to wait and see which of the vaccines would work best before we make a decision as to which vaccine we choose. And that comes at a cost. And the cost that it comes at is loss of life, because we delayed in making the decision, we delayed in engaging in bilaterals, and consequently we were delayed in when we get the vaccines and start our rollout of the program. And now we're in the midst of at the beginning of a third wave. And unfortunately, the rollout of the vaccine, although it's beginning to gain traction, it's pretty much too late to mitigate the consequences of the third wave. And what we're going to face is already our hospitals are coming under pressure, and we're going to have people dying, especially high-risk individuals that should have been vaccinated.
Yeah. You say there should be consequences. Against whom?
Well, the people that were responsible for planning, the people that were advising the Minister of Health as to wait before they make a decision as to which vaccine South Africa should actually use. And within the Department of Health, the people that were mandated by the minister himself to basically ensure that South Africa gains access to these vaccines. In any other democracy, to experience what we are about to experience in South Africa would be completely unacceptable, and especially more so for there not to be consequences. We need to understand that lives are going to be lost, and lives are going to be lost because we were delayed in doing what we should have done last year already.
And Prof, lastly, we were having this discussion in the newsroom yesterday. Should we celebrate 1 million vaccinations or not? Because it is ridiculous. We've only managed to vaccinate 1 million people over several months, and we're already in June. That's not something to celebrate, surely. What do you think?
Well, if you want to celebrate mediocrity, then we should celebrate. Certainly not. There's absolutely nothing to celebrate about. The fact that we vaccinated 1 million people when there's 59 million people, of 39 million people that government were meant to vaccinate by the end of the year, that are yet to be vaccinated, that is not cause for celebration. That is cause for reflection of failure.
That is very true. Thank you so much for your insights. We appreciate it and your work. That, of course, is Professor Shabir Madhi, Professor of Vaccinology at Wits University.